This short video is on the rehabilitation of tennis elbow. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type. And tennis elbow has another name. The medical name is Lateral Epicondylitis. Lateral means the outside aspect of the hand. So if we hold the arm like this, you see the humerus, the ulna, and the radius, and then the wrist here. This is the inside aspect, the medial side, and the lateral side is the outside aspect. So tennis elbow or lateral epicondylitis, basically it involves this part of the humerus where lots of muscles are converging, and these muscles are the ones that tend to do the extension of the hand, the wrists, and the fingers. So we call it tennis elbow because it's most often associated with that backstroke activity when you are extending the elbow, using these muscles again. But it's not always associated with tennis elbow. It can be seen in lots of other sports people like badminton, javelin throwers, discus throwers. Lots of sports can actually cause tennis elbow, and sometimes you don't even have to have a sports activity. It can be a bit of a stubborn condition because it can go into a chronic phase and it's very frustrating. However, if it's addressed at the early stage, I think you get a better chance in resolving it faster. So we're going to go through some of the rehabilitation exercises. The first exercise is extremely simple. All it involves is outstretching your hand in front of you. Make sure it's stretched out really well so all the muscles are stretched, and just simply drop your hand down all the way until you feel maximum stretch on the outside, and then gradually point it up towards the ceiling so that you're extending the other side as well, contracting that side. Drop it down all the way. So by doing so, you're contracting the flexors, but stretching the extensors. Good. Another variation to that is actually to use a bit of resistance, especially in the extension phase. And I want you to use your own hand to resist your own activity of extension. Yeah. So attempt to extend the fingers and the wrist, modest kind of resistance, and slowly let it go. And then again, push your hand and the digits up and resist, and then back down. Now resist your wrist and try to extend it against your own resistance. Hold on to that, count to 3, and then slowly relax. Obviously, if you have the painful phase of tennis elbow, you will feel the pain where the attachments are. The next one involves holding one of these sticks, what broomstick would do. Yeah, it doesn't have to be anything fussy. And you're going to do some extensions of the wrists and then flexions of the wrist together. Yeah. The idea is that if one hand is weak or not functioning, the other one will guide you to assist the range of movement. So make sure you extend all the way and then drop it down and flex all the way. Yeah. Another variation of that is actually to hold the stick from underneath and then do the same activity using more the flexors now and relaxing the extensors as you go back down. A couple of those. The next exercise, again, is engaging the extensors muscles, and we're going to do this in the semi-pronation way, like the karate chop position. So stretch your arm in front of you, and in a slow motion, raise your arm like this with your thumb pointing towards the ceiling. Pause it for a few seconds, and then back down, and then repeat this. Don't go above 90 degrees. If the band is too tight, then obviously we use a softer band. Mm-hmm. So the next exercise, it involves using mostly your flexors this time Again, you are stepping onto the band and flexing your elbow. Do not close your elbow fully, because if the elbow is inflamed, it's irritated, that might cause a little bit of irritation. Keep it at a bit of a semi-flex position, yeah? So again, this exercise, I suspect your specialist will say, do it later on when the acuteness is subsided, because strengthening exercises are reserved at a later stage, yeah? Andre, this exercise now uses the extensors, yeah? So you're going to use the elastic band for resistance, and you're going to extend your elbow, pulling the elastic band down. Try and keep your elbow, the arm in a straight line rather than doing the movement from the shoulder. We want the movement from the elbow, yeah? And with the fist facing upwards. So by doing so, you're using the extensors here, but also the extensors in your forearm. But also what I want you to do towards the end of range, when you take it down, I want you to extend your wrist backwards as well. That's it. So we're using the common extensor origin here. Lots of muscles there, yeah? This exercise, Andre, involves having your elbow at 90 degrees by your sides, yeah? And you're going to make the movement from your wrist and your fingers. You're going to extend them backwards against the resistance of the band, hold it there, and then go back to neutral position. Yeah, pause a bit, and then back down. Now choose an elastic band that is manageable for your own strength. And as always, we do it in a slow, controlled fashion, pausing between end of range points. Mm-hmm. The next phase of the exercises we're going to introduce now, they're called so-called eccentric exercises, and they're especially useful in tennis elbow and golfer's elbow. Andre, what I want you to do is to rest your forearm here, yeah, and you are going to assist your hand to pull the weight up, and in a slow and controlled motion, drop the weight down, therefore using an eccentric kind of force on the extensor muscles. And again, assist it to go up and slowly back down. Okay. Slow motion downwards all the way. Flex the wrist, and then assist it to go back up, and let it drop down again slowly. Thank you. The next exercise is similar to the previous, this time using an elastic band, whereby you extend your wrist backwards under the tension of the elastic band, and then in a controlled fashion, you go back to neutral. So do you want to put your arm on the table, wrap this around your wrist, and I'm going to hold it for you. If you're doing this at home, you can attach it onto a door handle or some other steady surface. Okay, so slow motion, extend, and then relax your hand. Let's maintain the tension though. Yeah. Obviously, it's hard to keep it in place because it has a tendency to slip. You can use the other hand just to make sure you keep it in place. Yeah. As long as you are doing the motion, yeah. Hold it, and then slowly back to neutral, and then again. So you're using that hand just to keep the tape in place. This exercise uses a hammer. Not that because it gives you a bit of a challenge, because they're not very heavy hammers, but also what it does, it gives you a perspective of rotation, what we tend to do with the two forearm muscles. Holding the hammer there, we are rotating the two bones against each other. Therefore, we're encouraging this movement with a little bit of resistance from the weight of the hammer. Do you want to put your forearm on the table again? Slow motion, drop it all the way. Make sure you go to the end of range, because we want to encourage the rotation, and then drop it the other way. This exercise is very similar to what we've just demonstrated using the hammer, but now we're using a weight. Again, it depends on your physical fitness, how much weight you can handle. You don't want to be stressing it unduly, yeah? So that is a 2.5 kilo. For most people, I suspect that's a lot to start with, but but just don't use that for demonstration. When you're doing this exercise, make sure you're sitting in a place that you're not going to cause issues with your spine or your neck or your body, because I can see you are leaning a lot. So maybe the table needs to be a higher table so that you're actually more comfortable when you're doing this. Unfortunately, we're using a low table there. Make sure you're okay with your back. So do the same rotations for me. Pronation and supination of the hand. Again, you've got a bigger grip there, which is challenging different parts of the muscles rather than a narrow grip, and a different weight, of course. Yeah. And gradually flex your wrist all the way up, and in a slow motion, let it extend all the way downwards like that. Yeah. Flex all the way up, contract it, and then extend it all the way backwards. Let it relax all the way down. Thank you. Basically, I want you to start by flexing the resistance bar to 90 degrees, hold it, and gradually do it back down. So what you're doing, you're rotating again the radius and the ulnar. You're using part of the brachioradialis and a number of other muscles to achieve that. Good. Hold the resistance bar vertical with both hands and do a twisting motion against each other. Take it to the end of limit, hold it there, and then twist it the other way, opposite direction with each hand. Hold it there, and then the other way. Once you've done a few of those, can you switch the arms over so you have the other arm on top? And change your grip. Yeah. Yeah. So make sure that when you're switching over to the other position, you are rotating in the opposite direction. Yeah. Next one, it's very similar to that. It involves outstretched hands. And again, this time we're doing flexion and extension, unlike the rotations we've done before. Take it to the end of range, pause, and then twist it the other direction. You're using the flexors and the extensors by doing that. And it's a graded kind of resistance because the kind of silicone nature of the device gives you a kind of graded resistance rather than a single weight. Yeah. And then the other way. Yeah. Okay, that's great. Thank you. So you need to loop this around your fingers for me. Put the thumb in the big loop. It's a bit fiddly to put it on. So let's have a look at you exercising the fingers by extending the fingers. That's good. And then back down. If it's too tough, then get a softer one. So extend. You're extending, but you're also abducting. So you're using various muscles, which is useful. If you put a ball inside your hand, as you finish the extension and you close your wrist, you squeeze the ball, and then you extend. Obviously, you need to prevent it from dropping. Another way to work on this part of the arm, which is basically the symptomatic area, these muscles can be quite tight and inflamed, is to roll the ball gently on your forearm muscles, yeah, especially the extensors here, to a small area, not all the way up and down, just a small area, and then move to another area and so forth. And a little bit at the attachment area up here. If it's very painful, less pressure. Sometimes after this kind of exercises, you may want to cool down the attachments and the muscles from becoming inflamed. So taking a cold pack from the freezer, like a gel pack, putting it on top prevents a reaction. There's another type of device that helps to massage the arm and forearm muscles, especially the extensor muscles there, and it helps to stretch them. So for that, you need to roll your hand over those muscles. Obviously, this side are the flexor muscles. On that side, we're rolling the extensors. Maybe you need to assist it a little bit with the other hand. You want to demonstrate. If it's painful, then don't put so much force on it. Yeah. Slow motion. Yeah. And move further up as well. Good. As we said earlier on, when we're rehabilitating part of the body, we don't just focus on that individual spot. We go beyond that. We look at the adjacent muscles, the adjacent joints, make sure they're all functioning well. Otherwise, the condition doesn't resolve well. So we were dealing with tennis elbow, but what's happening with the shoulder? What's happening with the wrist? What's happening with the shoulder blade? How is that moving against your chest wall? And the muscles that control that. So there is one particular exercise which can be beneficial, is for you to lie on the floor and to do some, like a butterfly extension of your arms. So lie down and put your arms by your sides and point your fingers up towards the ceiling. That's it. So we're actually exposing the extensor muscles there. So in a slow controlled motion, extend, hold it, and then back down. We are using quite a lot of extensors, but also we're mobilizing the shoulder blades and then the rhomboids as well, helping to stretch the front as well. And once more. Andrea, thank you again for your help.
Thank you.
Tennis elbow or lateral epicondylitis, additional management advice. Avoid painful movements, particularly those that involve straining the forearm muscles. Reduce repetitive twisting movements of the wrist, gripping and lifting. Make sure you take regular short breaks from activities that aggravate your elbow pain, such as typing, lifting, or repetitive work. Change activities to reduce pain, for example, the use of ergonomic equipment. Limit the stress on the tendon by adopting a relaxed grip. The application of ice packs to reduce inflammation, compression, self-massage, medical acupuncture or dry needling, strengthening exercises, the use of straps, braces and splint devices, exercise modification, topical anti-inflammatories, advice on load management, and in stubborn cases consider corticosteroids injections. Eccentric exercises definition. These are active movements that lengthen the muscles, which are unlike the passive stretching exercises. It's a type of strength training that targets specific muscles to control a weight as it moves in a downward or away motion. An eccentric contraction is the motion of an active muscle while it is lengthening under load.